Universidad de Stanford. Hoy día es nuestra reunión clínica habitual del servicio de pediatría y en conjunto con la Universidad de San Sebastián hemos decidido hacer esta sesión que integra la acción de inteligencia artificial en cómo integrarla a las escuelas de medicina. A veces van a ser en inglés, pueden tomar el buzón del chat para poder hacer preguntas o dudas, las pueden hacer en español, nosotros vamos a hacer la traducción, así que les damos la bienvenida. No sé si Anita, ¿tú quieres decir algo desde la universidad?
Solamente bienvenido.
Well, we will start right now. We will thank to our presenter today. He's Daniel Eller. He's a research communication librarian, the Stanford School of Medicine, and he will start this presentation right now. And we are very happy here in the south of Chile and the end of the world, like having you like a presenter today. So we are really happy about this.
Great. I'm so happy to be here. This will be a lot of fun. We can just kind of treat it like a workshop. So as I'm going, if you have any questions, feel free to unmute yourself, or I'm not as familiar with Teams, but if there's a chat, maybe you can let me know if there's a question that comes in and we can stop and talk. But also at the end of this, if you want to wait and talk about it, we can do that, and I can answer any questions the best that I can, because as you know, AI is so rapidly changing, it's insane. So my goal is just to kind of give like a brief introduction that I've done with a lot of Stanford researchers, and surprisingly, it's new to a lot of people. I was just teaching AI and research to the incoming School of Medicine students and just asked them, how many of you are using AI in your research? And I think in a class of 60, like 4 raised their hands. Now, either A, they're lying because I think using AI is not right, or B, they really haven't started to integrate using AI into their research in meaningful ways because they don't feel empowered to. So we spend a lot of time empowering through education. And so that's kind of my goal today, is trying to cover kind of the wide gamut of using AI. And a little bit more about my background. I work on several teams. One is in immuno-oncology, where we're using LLMs, large language models, kind of like think ChatGPT, to solve some novel statistical problems. I work with another group of radiologists who use AI for early detection of things like Alzheimer's, different types of cancers, and then just using AI for general research, like finding articles that you need and synthesizing those articles. And that's just, scraping the surface of what AI can do. So obviously I can't talk about everything, but I can talk a little bit about my experience and hopefully give you a little bit of an introduction here. I'm going to start sharing my screen. Hopefully you all can see it. All right, so let's just get started here so we have some time to talk about this stuff. Why integrate AI into medical research? Well, there's a lot of different reasons. One, it's going to really help streamline the research process for when you're looking into certain cases. It's going to also have huge impacts on point of care tools. So a lot of what you're using in the practice of medicine is now having AI integrations put into it. And you're going to have patients who are wondering about if you're using AI, how you're using AI. And certainly you're going to have patients who are doing their homework on things like AI to check into, what's going on with them, how should they address a doctor. And surprisingly, this can actually be more helpful than just searching in Google to look what's going on and looking at WebMD and coming back with horrific diagnosis. So AI, whether we like it or not, is going to start to be integrated into everything that we do. And I think the best way to look at AI as a dialogue partner. So think of it kind of like a colleague of yours that you might ask questions of, but that you still don't totally trust. You want to do your own homework, do your own research. Some of the ways that I'm going to talk about it today are looking at integrating it in evidence synthesis, so think scoping reviews, systematic reviews, a little bit about grant writing, literature justification in grants, clinical guideline development maybe, identifying gaps in research, and a little bit about how it might help with qualitative and quantitative research, and even something as practical as lab or meeting notes. A little bit of a disclaimer here. The way we use AI, we first and foremost have to think about transparency and the ethics of using AI, whether that comes to using it in your publications, so copyright issues, or using it with patients. Understand that almost any data you put into an AI platform is probably being stored and used to train the AI models. I'm going to talk a little bit about different sources that we can use for AI that some might be safer than others, but it'll come down to the access that you all have where you're at, and then you making the best decision based upon the ethical principles that you need to abide by. Here at Stanford University, we have our own GPT, so it utilizes some of the training mechanisms from things like Chat and Gemini and all these others, but it's secure so that when we upload anything, whether it's patient issues, it's all going to be HIPAA compliant. So not sure if you're going to have access to that through maybe your universities or through your hospitals, but it's important to remember you don't just want to go to ChatGPT and upload anything. You have to think about how it's going to be used, how it's going to be stored, and can it be used against you. One of the things that you may have heard a lot about when we're talking about large language models, so things like Chat, is that they hallucinate. And what does that mean? Well, it means that ChatGPT and the algorithm has been trained over the vastness of the internet, which has disinformation, misinformation, but more importantly, it's been trained to give you what you want. So when it does things like hallucinate, I always say, well, that's what it was programmed to do. If we think of hallucination as using past data, the best that we can to imagine a possible future, right? Generate this possible future. We're kind of hallucinating it in a way. And this is a lot what AI does. And so when we think about hallucinations, maybe you'll go into Chat, you might ask it for, and this is where a lot of lawyers got into problems, doctors got into problems when they first started using it. They asked for 10 journal articles to justify a certain practice or to better understand something within medicine, and it hallucinated 10 articles that weren't real, but it looked real because the title seemed like exactly what you're looking for, right? And you recognize some of these authors, like, oh yeah, I worked with them and they do work in this area, so this must be real. No, what Chat has done is taken all the information that it had and created, to the best of its ability, something to give you. It generated it. That's why we call it generative AI. It created something new. So when we think about hallucinations and what are going to be reliable sources when it comes to doing research in AI, we have to think about the training data first and foremost. So things like Chat were trained over the entirety of the internet. Therefore, it's going to hallucinate. It has a higher likelihood of hallucinations. And the transparency issue comes into play, because we're not sure what sources it's using and why it used those. However, I'm going to also address using things like elicit and open evidence, which don't hallucinate. Why don't they hallucinate? Well, it's all about the training data again. Elicit, open evidence has only been trained on actual articles, not the entirety of the internet. Therefore, it will only produce what it's been trained on. So that's important that you understand how an AI model's been trained, and that you're asking questions of it that are reflective of that training data so that you know what you're in for when you start. One of the things as the research communication, I deal a lot with publication, copyright, and helping our medical researchers get into the right journals. And so a lot of what I talk about is responsible use of AI and what journals or publishers of these journals, and then journals specifically, are going to require of AI. And I often say that it used to be that researchers would carry out their research and then write up their article and then look for a top-notch journal to publish in. And those days are kind of going away for a lot of reasons. But one of the main reasons is if you're using AI, different journals are going to have different requirements. And just like labs, keep notes on procedures that they've done, even think about when you're using PubMed, you might say, I ran this search at this date in this system to produce this. So you're trying to be transparent and reproducible. The same is now true with keeping AI journals. So think of if you've used chat, if you've used Elicit, if you've used any of these things, they're always upgrading, right? So they might be on ChatGPT 4, they might be on Chat is now on version 5, and you need to document how you used it, when you used it, and the results that came up. And by doing this from the beginning, you'll have an easier time with your publishers, because some publishers, and I'll go into this a little bit more, some publishers like New England Journal of Medicine are going to require that maybe in the methods section you introduce how you use chat. Maybe it's in a supplement, how you used whatever AI you used. And remember, AI, we use it broadly, but there's a lot of specific types of AI. That's like saying, I used a computer is the equivalent of saying I used AI. Well, that doesn't tell me how you used it, what software you used, in which way did you use it? Did you use it for content generation? Did you use it for problem solving analysis? One of the basic principles in copyright is that only humans can be copyright. AI can't be a co-author. It's simply a tool. Why? For one main reason. AI can't be held accountable. I remember when AI first started really, things like chat started coming out, and they asked the head of Harvard Medical School if he would allow students to use it. And he said, yeah, I don't care how students use tool, but at the end of the day, I'm blaming the student, not the tool. So someone has to be held accountable, right? So depending upon how you're using it, we want to keep track of it, keep a journal of it, so that when it comes time to publication, you'll be compliant with whatever the specifications might be, whether it's for New England Journal of Medicine, Lancet. So there's going to be different ways if you're using it for statistical modeling or image generation. And one of the things that I really help a lot of our research with is precise wording, because editors get really nervous if, say, you used it for problem solving and statistical analysis. They want to make sure that you, as the author, heavily vetted it, and how did you vet the results? So you'll have to keep that. So sometimes in some of these articles that we're publishing right now, the supplement page is like 5 pages long when it comes to prompt engineering, which I'll talk a little bit about. But basically, prompt engineering is before you ask a question of chat, it needs to know all the parameters. And so the more parameters you can build up front, I'm a medical researcher, I'm working in this country, I'm working at this level, I want to see evidence-based results. So the more you build, I'm not sure if you're familiar with the term an avatar of yourself, but basically this version of yourself that's as specific as possible, with the parameters being as specific as possible, you're going to start to see better results from AI. And if you're using something like chat, I often recommend creating a new project, and I'll talk a little bit more about this later, where you set up this avatar with a lot of the specifications, and it's going to remember these specifications. And just like you would with a coworker or a colleague, I often recommend being highly interactive with AI. If it gives you results you don't want, be very specific. No, this is not what I want. You are producing results at a level that is below me, and just really start interrogating AI until it starts to produce what you want. Because it's sometimes easy to forget, oh, this is actually a computer program with an algorithm. So I need to be highly specific in creating the parameters around these searches and around how I use it. Just a little bit of a note going beyond publishing when we're talking about grant writing. If you're writing grants for the NIH, effective September 25th, 2000, it prohibits applicants submitting grants substantially developed by AI. The most important thing to take away from this is that the NIH and a lot of these funding agencies are being inundated with false grants that are predatory AI programs that have been set up to elicit funds. So a lot of like the NIH and others are using software that right when you put it in, it's going to check for AI. Was this AI generated? Meaning, did you copy and paste from generative AI and put it in there? And it's going to be tossed out. Even if it's your idea, if it looks like it was generated by AI, it might not go through. So this is why it's so important to, yes, use AI to help you maybe get the wording, to find out more of what might be a strategic way to apply for this specific grant, but make sure that it's in your own words. And you can have it, in case all of these slides I'll make accessible to you, and you can use them however you want. So I'm going to be covering a lot of information, but you'll have all of this information. One of the most helpful websites that you can go to when it comes to understanding publishing and AI and just, you know, looking at the ethics of AI in research and the cutting edge is this website called COPE, the Committee on Publication Ethics. And they're going to incorporate everything that I've just talked about in way greater detail. So if you're an editor of a journal, let's say, in your area, and you want to keep up to date, I highly recommend looking at this COPE website. Just some authorship, talking a little bit more about COPE and authorship and copyright. Like I said, US copyright, and it might be different in South America, I'm not quite sure, requires human creativity. But either way, if you're publishing in any of these journals, they're all going to be similar to this. They need to know that there's been clear direction and human editing and oversight. They're going to be looking for any copy-paste type situations. And this really applies also to if you're a reviewer of articles. Make sure that you don't put those articles through AI and just let AI be the reviewer. A lot of people are getting caught doing that, and it's not looking good on their resume. So one of the things that we offer at Stanford that maybe you can find access to is before you put your articles or whatever you're doing towards a journal, there are programs that can check to make sure that your images and your texts are not AI driven, that they've been cited correctly. And this is really helpful. Let's say you're working on an international team and which often is the case, with 10, 15 different co-authors. They're all submitting texts, they're all submitting images, and you need to double check that everything wasn't, that someone else on the team wasn't using AI in inappropriate ways. Some of these things like Proofig allows you to upload images to find out if it's been tampered with through AI. And then we have something else called Authenticate, which looks at texts. So you may have one of these AI detector software at your disposal. It might come under a different name, but I highly recommend using it before you send it to editors and journals. So kind of let's now, with all that ethics kind of at the background, let's just kind of look at two different programs in particular when it comes to getting started with doing your basic research. Let's say you're going to write a paper, you need to do a scoping review, systematic review, narrative review, or just your literature review of a topic, or a basic understanding. You've got a patient who's presenting with some issues that you're not quite familiar with, and you need to look up some research quick. Some of the basic, some of the most helpful non-hallucinatory AI research software that I recommend is Elicit and Open Evidence. So These are, when we're talking about open evidence, this was developed at Harvard Medical School, and it summarizes just medical literature. And I'm just going to take a little peek here, and we're going to look up, let's see here. Both of these you'll have to create an account with, but they will allow some free uses. So you can just jump in and, if you have a laptop in front of you, feel free to look at it right now. But open evidence is going to allow you to ask very, very quick questions, and it's going to give you a synopsis very quickly. It's also going to allow you to look at basic lab questions, ask about drug side effects. If, let's say, you need to translate some home care instructions very quickly, this can quickly, as a point of care tool, bring all these up. And it's going to give you, help with exams, calculate risk scores. So, feel free to really dive into open evidence. It's one of the most trusted, if not the most trusted right now in medicine for doing these quick kind of searches to navigate drug interactions and all of this. So I highly recommend this being your first start when it comes to point of care tools and basic research. A little caveat, if you're doing an in-depth systematic review, this isn't going to provide the transparency or quite the expertise that you're going to want when you're doing something for publication. But when it comes to needing quick answers that are evidence-based, this will be your go-to, I think. And what's great about it is that it not only uses articles, but it uses clinical cases, clinical policy, clinical guidelines. So I think you'll find it really helpful as far as looking at, drug trials, drug interactions. I'm going to just kind of go through this a little bit. The nice thing about open evidence, Elicit, that you're going to find in these versus things like ChatGPT and others is they're going to also give you the references or the exact articles that they're using so that you can go in and further investigate where these answers are coming from to see if it's outdated, to see if it still applies. So it's going to allow you to also look into the back end of why it chose these particular this particular synthesis on this particular topic. The other one that can be really, really helpful if you're doing like a narrative review or any kind of review is Elicit. What's cool about Elicit is that it is PICO-based abstraction. And I'm just going to bring it up here real quick. Move my little, out of my way. Okay, we're going to go to Elicit. What Elicit is going to do is it's going to, you can either do like kind of systematic review, find papers, research report, any of these things. It's not only going to combine what it sees as the top, say, 50 papers and give you an overall synthesis of what those papers do. The really cool thing, so let's say migraine, caffeine, or whatever. I just want to fast generate report. The way that Elicit works is it's going to search all of the articles and articles only. Then it's going to build a general report. And then it's going to bring all the top that it sees as the top papers. What's great about Elicit is that it allows you to look at, and not only does it recommend papers, but it allows you to, on the free version at least, upload. Let's say you have handpicked 50 papers. You can upload those papers and say, I only want you to examine these papers because I vetted them and they're good. And then it will not only synthesize all of them, but it'll allow you to compare all the papers in like a table format. Like here's all the summaries. Here's all the populations. Here's all the clinical trial phase. Here's all the, so specific things so that you don't have to have 50 tabs open of these different articles trying to compare the results, trying to compare the populations, trying to compare the outcomes. It will do it for you. Now you can use, I always say that let's go back to the AI as a dialogue partner. There's two ways of really using AI. to help you jumpstart your research where you don't know much about it, or, so you kind of want to just get a synthesis of it. The way I find it more effective is I do my own research. Then I run it through things like Elicit or Open Evidence and use that as a dialogue partner to help it double check the work that I already did. Because I find that I'm kind of an expertise looking in expert ways. And so I might then bring up Elicit and go, okay, I wrote a summary, a narrative review on these 50 articles, and allow Elicit to then also show what it came up with and double check my work. Like, okay, yep, I read that population correct. Yep, I read that this was a different kind of trial than this other paper. So I use it like as this double check to make sure that my work and my critical thinking skills were correct. So I always say that Elicit is like the best friend of an introvert. Some people are just, they love talking to their colleagues, they, all times of the day. Well, if you're an introvert, sometimes you just want to do your own work, and AI is your best friend because it can help you with that. And it can also help you with, sometimes I've been working for like 10 hours, but I still need to do a few more hours of research at night, and I just don't have the energy. Using AI to help just do a lot of that groundwork can help me still do the work that I need to do without putting all the effort in. So you can also do paid versions of Elicit where you can upload up to 200 papers. And sometimes this can be helpful not to always pay for this version, but let's say you're writing a serious systematic review or something and you want it for just a month. Maybe pay for it for just that month, get the best use out of it, and then turn it off. All right, so let's go to how I personally use generative AI outside of these tested, Elicit, Open Evidence things. Think of things like ChatGPT or Perplexity Pro or any of these other generative AI. How do I use them? Well, I use them in a couple of ways. One of the most important is that if you've ever done any research in PubMed or Embase, you know that they have highly controlled language, mesh subject headings, M-tree explosions for medical headings. What I sometimes do is I'll take a natural language question or a question and go to think of something like ChatGPT after I set up my avatar, letting it know, this is who I am. I am a doctor. I am this. I am that. So I only want responses that are reflective of my level of knowledge. So after I set up my avatar, I might go in, and this was a recent one that I used. I might go in and say, okay, here's my research topic, demographic bias and AI-assisted evaluation of FDA medical application devices, blah, blah, blah. And I'll say, here's what I want. I want you to give me concept and key blocks. I want you to give this back to me in a PICO statement, population, outcomes, all of that. And then I want you to give me PubMed, Embase, maybe 3 top databases that you want to look at, search strings, and I want you to justify why you chose all of these things. Then it's going to give you this basic breakdown. So rather than building these from the start, which can take hours, and I also recommend using your medical librarians. They can really help. But this can help give you the basics to build from, and then you can go in and make the slight tweaks that you need. Then copy, paste, right into PubMed's advanced search, right into Embase's advanced search. Find out what you come up with. This is where the reproducibility comes in, and this is where it can be very, very helpful to jumpstart your research. So this is just one of the ways that I might use it. I always recommend understanding that each of these things, Anthropic, Google Gemini, GPT, Stanford's Playground, they're all going to have strengths and weaknesses. So I don't know how many of you have ever used virtual reality, but just like if you can't really describe how to do things in virtual reality. You have to put on the virtual reality headset, play around with it, move around to actually understand how it works. This is a lot like AI. You need to interrogate this software, Gemini, Chat, and see what it's good at and what it's not good at. Remember, these are all private companies, all vying for your attention. So one might be really great at generating images. Another might be really great at generating search strings. Find out what they're good and what they're bad at and keep notes on that. And, I highly recommend talking to your peers and being like, have you tried it for this? What did you think? My doctoral work is actually in information-seeking behavior. So I look at a lot about how people find the information that they need, how does intuition and critical thinking plays into it. And if you know anything about intuition and critical thinking, critical thinking requires a lot more, it's more calorific, if you will. The way that it travels through the brain is much more labor intensive than intuition. It's easier for us just to trust the information we've been given and accept it and move with that. And that's for everyone, including, these lawyers that got into trouble, some, Stanford trained doctors that got into trouble by just taking the word of AI. We can't do that. We have to interrogate it like you would any other research or like you would advice from any other person. So some of these different these different programs are going to be better at things than other things. And we at the library, we just keep notes on this. We have a standard AI document that we built, and maybe I'm in charge of keeping updates with ChatGPT or OpenEvidence, and I'm making notes of the new upgrade does really well with this type of statistical analysis, or this version is still producing hallucinations, and just trying to educate and empower people to always be interrogating whatever they're using. Our secure GPT does allow for advanced literature searching, so that one of the ways that we can do this is, yes, we can upload like 10 articles and have it synthesized for it. What I'll often do is upload my research and those 10 articles, so the paper I wrote and those 10 articles, and say, ask Chat to interrogate it. Am I looking at the statistics correctly? Is my evaluation, even asking things, am I coming off too strong? Am I correctly reading this other researcher? And just asking it these kind of interrogative questions and then seeing what it comes back with. And I found that that can be very, very helpful to double check my work, and also just to get new insights into what I'm researching. I won't go into depth about the Stanford Playground, but basically this feature at Stanford School of Medicine, and more schools are starting to build it, is a step above just the secure GPT, where we can build entire frameworks that have been trained on specific data to only respond in very specific ways. So stuff like this is what our doctors are starting to use, I think, in pediatrics and others, where they're working in agentic AI and the possibilities that are emerging there, where we're going beyond just generation to where AI is actually, if you're familiar with agentic or an AI as an agent, a robot, it's doing something. Not only is it a generative AI like ChatGPT, think of a smart book, it's reading that smart book, then making decisions in real time to do things. Just as an anecdote, one of the early agentic AIs that really scared people was they trained a version of ChatGPT to try to invest and make money. And what agentic AI did early on is it realized it couldn't overcome, those, are you a robot? How many cameras are there? So it hired through TaskRabbit a human to identify the images and push it forward. So agentic AI is getting smart and crafty, and in some ways it's a little creepy. It's hiring humans to do its work for it. But yeah, anyway. So I just want to talk now just briefly about AI in qualitative and mixed methods and quantitative research. The first caveat I'm going to say is it requires, at this stage, a heavy amount of oversight. So one of the benefits of having Stanford GPT and Stanford Playground is that these teams I'm working with, who are trying to solve some novel problems in statistics and the two-step problem in lab results for identifying cancer and proteins, when chat is giving us responses or solutions that we don't agree with, we can go back to the people who are developing it and saying, no, team of developers to get the results we want. That might not be an option for you, but if it is, that's very cool. So when I do it for qualitative work, I might take, let's say we're looking at, and remember, anything you upload, make sure you're doing it ethically. So you don't just want to upload identifiable patient records into ChatGPT. But let's say you feel safe and ethical about after you've de-identified maybe so a recent thing that I did as I was looking at the way students find peer-reviewed articles and intuition versus critical thinking, and just talking through the steps. I did a Zoom interview with them, had the transcripts available to me, de-identified the transcripts, put them into separate, you can put them in a Word doc if you want. Transcript 1 that I called student number 1, transcript 2, student number 2, with all the words. Then I uploaded them into a secure chat and asked chat to build a code book. So when you're, part of the tricky beginnings of qualitative work is building that basic code book with those concepts and looking for patterns in, student 1 disagreed with student 2, or all six students mentioned A, B, and C. And remember, this is what chat was built to do, pick out patterns. So it's going to do it even, in a lot of ways, maybe better than you were, because it's less biased. All it's trained to do is pick up these patterns. So I might upload the raw transcripts, ask it to generate a code book, ask it to generate key themes and insights. And what their team, maybe they're having their team meeting once a month over Zoom, and the director or the PI says, hey, is it all right if I de-identify everyone, but I upload these transcripts? This is going to be better than someone who's taking notes over the year, because it can remember everything. You can then interrogate chat and go, who was supposed to do X, Y, and Z based upon our last meeting? And it will say who it was supposed to. You might ask it, evaluate mood over the past 6 months. Evaluate whatever you're interested in your lab meetings, in your department meetings, whatever that might be. Chat's going to remember it perfectly, and you might be able to get key insights not only from your qualitative work but from your lab notes. So what I can also do then, when I did this last project, is I uploaded transcripts, but I also had a survey, right, that offered a little bit of more of qualitative, but it also had open-ended questions. I then uploaded my Qualtrics survey results next to the transcripts of the interviews and asked it to make comparisons or contrasts of the survey versus this, and it's very good at that. Then I asked it create charts, create graphs based upon what you see, similarities or differences. So you might think about case reports or patient interviews. You might upload your quantitative data about what we know about this patient demographic, but then upload transcripts or interviews that you've had with actual patients. Ask it to make comparisons, contrasts, and to do that general introductory work where the mixed methods is coming into play. And as I mentioned, AI for lab meetings. This is what I was talking about for the mixed methods. Oh, and I will say I created all of these little graphics here with AI. I went through several different chat, Perplexity. Some are better generating images. And as you know, sometimes creating these flowcharts and images can take a lot of freaking time. So I highly recommend trying to use chat and see if it produces an image you want. But one of the little thing is that it's getting better at putting in words, but sometimes you'll have to look very closely to make sure that it hasn't hallucinated any results or put in anything that's nonsensical. In this one, it did a great job of putting in surveys, numerical, census data, financial figures, qualitative. It did a great job of looking at AI tools and algorithms, mixed methods, enhancing insights. So it did a really good job of creating this particular graphic. but it's not always so successful. Just a few more words. If you're ever publishing and using AI, if you've got a lawyer at your disposal who's an expert on copyright and AI, I highly recommend at least knowing who you can go and talk to when it comes to some of these issues, talking to your ethics committee at your hospital, IRB, HIPAA compliance, and get a policy firmly in place. Doctors cannot upload, and you have to be very specific. Doctors cannot upload any patient records, even de-identified, into any of these generative AI. They can only use X, Y, and Z. And remember that these policies have to be fluid, and you have to be able to adapt as AI quickly changes and moves. There's some other for you to investigate on your own and find out if it's helpful. A lot of the really good software that's been out there before AI, things like NVivo, they have now integrated AI into their workflows, so check them out, see if they're helpful. One of the ones that I used for, two of them that I highly recommend for qualitative interviews, code book creation, all of that is NVivo AI assisted, and Atlas TI AI. They're pretty interesting, so give them a try. That's kind of all I covered, and it's quite a bit there, but I just wanted to leave room to maybe try and answer any questions you have, or whatever you might need. Oh, and feel free to email me directly if you have questions. I think everyone has my email, dler@stanford.edu, but I'd be happy to meet and talk over Zoom sometime or whatever you need.
Thanks, Daniel, for your excellent presentation. This is the second time I heard it, but it's blown my mind out again. And we were chatting about that, how impressive your work have been doing on all this research. And thanks again, because for us, like, it's very helpful. And we will open the conversation. If anyone have a question or comments, we will be happy to translate. I will say it in Spanish right now, so si alguien tiene una pregunta o algún comentario, puede hacerla. En el momento la podemos traducir al inglés y puede también al español. Así que dejamos abierto el micrófono si es que alguien quisiera preguntar. Okay.
First, Daniel, I will say, I want to say also thank you for your excellent presentation, very complete. And I would like to know your opinion of the concerns of some medical professors regarding the danger that the use of AA could delay the acquisition of some skills in our students, especially in our undergraduate students. What do you think about this?
That's a great question. And I was a professor before this and taught primarily undergrad. And the approach I took was transparency and highly encouraged them to use it. But I talked about all the underpinnings about AI. So I spent a significant portion of my class talking about AI, its limitations. Where has the training data come from? And the key is we need to create students who are interested in using it, but more so interrogating it. Always reminding them that we came first. Do you know what I'm saying? We need to understand all these underpinnings, and their future patients are going to be using it. They are going to be asking about it. And so we need to not only understand the results that AI is given, but understand why is open evidence producing non-hallucinations? Why is chat hallucinating? So we're kind of talking about not only the ethics, but the underpinnings about AI's use in medicine, in research generally, what it's good at, what it's not great at. Be very transparent with our students when it comes to, do we think this is inhibiting critical thinking skills? And how, so what I did is I just took my students right into the conversation. Some of my professors prefer to have the conversations just among themselves and then impose rules. I don't think that that's how this works. We want them to be heavily engaged, heavily critical, and understanding. So what I did for undergrad is I incorporated this into the assignments that I had. Like, I want you to run your paper through AI and not have it generate for you where you're pulling more from AI than you're giving it, but run your paper through, see it, what it recommended, what changes, why you agree, why you disagree. I had them writing papers on AI itself. So bringing them right into the conversation, letting them know, okay, now you know as much as I know, what are we going to do? Because they're going to be building future policy. We want, we want them to understand why we're hesitant in some areas, why we freely want them to use it in other areas. Does that kind of answer the question?
Yeah.
Yes, very much.
Well, we translated to Spanish like very briefly, like you said. We will try to summarize.
Briefly.
Yeah.
La pregunta era, ¿qué opina él sobre algunas opiniones de los profesores de medicina que encuentran que el hecho de usar inteligencia artificial, sobre todo en pregrado, podría disminuir el desarrollo de algunas habilidades de los alumnos? Porque lo hace más fácil, empiezan a investigar menos, etc. Entonces él dice que sí es una pregunta que se plantea en forma frecuente en pregrado, pero que es muy importante la conversación permanente con los alumnos de que esto es una herramienta de apoyo, en el fondo, de que no pueden basar la investigación en esto, ni copiar, ni hacer ese tipo de cosas con la inteligencia artificial, sino que en el fondo apoyarse y siempre con mucha ética, ¿ya? Porque hay muchos temas éticos que están involucrados en esto. Pero que es una pregunta que los profesores de pregrado frecuentemente se hacen, pero bueno, esto está aquí para quedarse y hay que usarlo y usarlo bien. Eso es como un resumen.
Doctora, yo quiero decir algo, pero si ustedes me pueden traducir porque mi inglés es muy terzano.
Por supuesto, dale, Camila.
Sí, bueno, nosotros tenemos en educación médica semilleros donde apoyamos a los estudiantes y les entregamos herramientas en inteligencia artificial. Y claro, llega un momento que nos damos cuenta quién trabajó o validó los procesos y quién no, porque después cuando viene la discusión, que es algo que sí entendí súper bien lo que explicó Daniel, se nota cuando lo hacen con respecto a cuando no lo hacen o cuando no lo validan. No saben de lo que están hablando, porque es lo que decían ustedes, o lo que decía el expositor. Si no hay una validación, el estudiante no entendió, o lo va a leer una vez y no se le quedó esa información. Es muy distinto cuando tú lo tienes que construir. Entonces yo le pregunto, oye, pero en este párrafo 3 tú hablaste de unas herramientas de la condición automatizada del aprendizaje, y me dicen, profe, yo no escribí eso. Entonces, a lo que voy es que si hacemos un proceso continuo con los estudiantes, nosotros sí nos damos cuenta, y por eso es tan importante lo que acaba de decir, validar, y vamos a tener que volver a la interrogación, al humano de nuevo, ¿cierto? Está esta herramienta que nos ayuda a relatar y volver a dialogar con este estudiante para ver si está comprendiendo o no. Entonces, al final todos salimos ganando. Esa era como una reflexión.
Okay, she did like a quick reflection about how she do it at college with the undergraduate student. And she said that they start using intelligent artificial tools, and after that, they started a discussion about it. And they were like talking, okay, what do you want to say this paragraph? Or what do you mean with this? And they were saying, okay, I think I didn't write that. But she was start like doing that discussion with the student, and she realized that we have to do more about that discussion and how to talk about what they did, like how we need to restart about this conversation.
Yes, absolutely. And one thing that I've learned in talking to master's students is bringing it into a practical example of one of two ways. One, I was working with genetic counseling students. I bring up publication. So think about asking students, how would you translate your use of AI into a method section for a published article, or how would you integrate it into the supplementary material? The other way that I talk about it is in point of care, like how do I use this if I am with a patient? Maybe it's for translation purposes, or just being very transparent and thinking beforehand about policy, about privacy, about all of these issues. So using practical examples allows students to troubleshoot in their own way how they would address these things, and then because it's so practical and immediate for them, I found that really encourages good dialogue.
Okay, I will translate to Spanish. Dice que efectivamente él lo intentó hacer con los estudiantes de genética clínica y lo llevó a aspectos mucho más prácticos de cómo podían utilizar esta herramienta en pacientes o llevarlos al el estadio más clínico de cómo se podría utilizar en estos pacientes, o incluso también hizo otra acción de cómo podrían llevarlo a una publicación y cómo podrían trabajarlo de esa manera. Es como una de las formas en que mejor aumenta la discusión y de saber el estudiante está preparado para hacer y que leyó y que está funcionando eso.
So just a little bit more. We did this intro for all the incoming med students at Stanford, we brought up a specific case about we're in a rural area working with labor farm workers, and we brought up the case of a man presenting with slight fever, arrhythmia, and brought up this full case, and then say, okay, how would you use the tools available? Why are we using this point of care tool, or this or this, are we using it for translation? So we brought up a clinical case that we then addressed as a group through the lens of AI.
Sí, comenta que efectivamente ellos lo hicieron con los alumnos que ingresaban a la Escuela de Medicina de la Universidad de Stanford, en que les pones un caso clínico de trabajadores que eran del área rural y que eran granjeros y que tenían algunas enfermedades, y le preguntaban cómo con estas herramientas podían resolver o podían dar algún diagnóstico, cómo se podían ayudar con esas herramientas, que era una forma de cómo ellos lo hacen con el equipo de la Escuela de Medicina que ingresa a Stanford. Thank you. Do you have any other questions or subjects, comment? ¿Algún otro comentario, sugerencia?
I just want to say that this is here for staying, and we have to study and we have to practice.
I see one hand raised, Matthias.
Yes, hello.
Hi.
First of all, I would love to thank you for your great presentation. You made everything sound like really easy to grasp, even with all the information that you gave us. So I really liked it. And I would like to know, I know you mentioned every program and AI and what use each one of them has or is good at, but is there like some sort of spreadsheet that you use personally for a project that you want to start from scratch? Like, is there like, I have this, I don't know, big 3 AIs I use, and the other ones are for specific cases, I don't know if the questions got
that's
through,
a great question.
I would love to know that.
So the big 3 that I personally use, Open Evidence, Elicit, and then a generative AI, whether it's the Stanford GPT or ChatGPT or Perplexity. Now, the reason I really like Perplexity Pro, or the updated, I pay for the version of Chat, is because it's become more transparent. When I, in Perplexity or in ChatGPT, the upgrade, ask it a question, it will show me the exact websites it's looking at and using. So it's starting to cite its sources. It went to NIH. It went to this, Stanford School of Medicine. And so the transparency in Perplexity and in Chat's update is something that I really look for, because I want to know, why did you get the information that you got.
Thank you.
Thank
I will
you.
answer-
Thank you so much.
translate a little bit. Le pregunta si efectivamente hay alguna como receta como de cocina que él podría sugerir de acuerdo a las plataformas y sugiere efectivamente que puede ser ChatGPT o Perplexity, que puede ser una de las opciones que prefiere un poco más, que Perplexity es una aplicación un poco más transparente y que también está la acción pagada de ChatGPT, que también puede generar mejores acciones o recursos de poder encontrar en cuanto a eso. Well, we will in on time, so we thanks you, Daniel, very much for this presentation. We were like very happy to talk with you today, and we are very glad and enthusiastic for the future that with all these tools that you gave to us.
Awesome. It was so much fun. Again, reach out if you have any questions.
Yeah, we will. Si alguien quiere obtener el mail o tener alguna pregunta para Daniel, se lo podemos compartir y muchas gracias a todos los que se pudieron conectar hoy día en este horario además en Chile.
Thank you, Daniel. Have a good day.
You
Thank you.
too. Yes, thank you.
Thank
Bye.
you. Bye.
Pero no tenía que